So cutaneous anthrax is the most common and fortunately the least dangerous form of anthrax. So how this would happen is someone would have an open wound and they would get soil residue with the endospores into that open wound. At that point, the endospores are going to activate and release toxins that would create an inflamed and dark-colored lesion on the skin. This form typically does stay within the skin and is not going to spread through the blood to other areas of the body. So it's very easy to it's very easily contained and very easily treatable with antibiotics, and most individuals would make a full recovery. Gastrointestinal anthrax is if you would ingest the Bacillus anthracis endospores, maybe from eating contaminated meat or eating like a vegetable that had the Bacillus anthracis endospores from the soil on it. So in this case, the endospores would get into the gastrointestinal system where they would activate, release toxins, and you would essentially feel like you had a very bad case of food poisoning, so vomiting, diarrhea, cramping. The problem here, why this becomes exceptionally more dangerous than something like cutaneous, is because when it gets into the gastrointestinal system, it can create ulcers and then easily get into the blood. And then once it's in the blood, this bacteria can typically throw you into septic shock, which can be fatal. So even with proper treatment, only 60% of patients will survive. So 48% of the patients will succumb to the disease. So it can be exceptionally dangerous. And then there's pulmonary anthrax, which is probably the form that you may be familiar with. This is definitely the most deadly form of anthrax. So this would be a case where you would get Bacillus anthracis endospores in the lungs. So this is essentially inhalation anthrax. So you would breathe in the bacterium into the lungs where it would activate and cause rapid inflammation. So fluid would start to fill the lungs and you would get a severe case of pneumonia. Then the bacteria would enter, typically through the alveoli, into the blood vessels. At that point, it would be in the blood, where it could release toxins and ultimately create a case of septic shock, where the patient's blood pressure would drop significantly and they'd no longer be able to get oxygenated blood to their organs and tissues, which can then result in coma and death. Even with excessive antibiotic treatment, only 55% of patients that have pulmonary anthrax will survive, which is why it is the most deadly form of anthrax. So the reason why Bacillus anthracis is so dangerous once it gets into the blood is because of its ability to produce toxins. So this bacteria has 3 different exotoxins, which we know are produced by some gram-positive bacteria. What these exotoxins do is they cause massive inflammation and shock. So in the lungs, that massive inflammation is going to result in fluid leaking into the lungs and causing a fatal case of pneumonia. If we're thinking about the blood, we know that during inflammation, those blood vessels are going to dilate, and in this case, they are going to dilate too much, become too permeable or too leaky, and fluid is going to start leaking excessively into the tissue, such as the lungs. And that ultimately is going to drop the blood pressure and create a case of septic shock. So this bacteria is incredibly dangerous because of its ability to produce those toxins. This bacteria also has a capsule, and we know from previous lessons, bacteria that have capsules are able to avoid phagocytosis. So this bacteria is able to escape portions of our immune system. And this bacteria also has beta hemolytic activity. So that means it is able to release toxins that can completely destroy red blood cells. So we can see where this bacteria would be very hard on the cardiovascular system. As far as prevention and treatment, there is not a vaccine that's given to the general population. A vaccine does exist, but it's only given to those who are at risk of exposure. So because this bacteria has risk concerned with bioterrorism, the military is vaccinated. And then individuals that work with animal hides that could have been exposed to anthrax-contaminated soil, those individuals would be vaccinated, but the general population is not vaccinated. As far as treatment, it is treatable with antibiotics. Again, sooner rather than later is always ideal. And even then, some cases like pulmonary anthrax, even with proper treatment, is not effective. But it is treated through the use of antibiotics such as penicillin and Cipro. I did mention that this bacterium does have bioterrorism concerns. Bacillus anthracis would be an ideal bacterium to use for bioterrorism. It can survive in harsh conditions for an extended period of time, so it could easily be packaged and sent to individuals for exposure. And it was done in this approach at one point in 2001. There were envelopes sent out to individuals, I believe 22 in total, with powder that had Bacillus anthracis endospores in it. So when those individuals opened the envelopes, the powder was released into the air with the Bacillus anthracis endospores, and those individuals inhaled those endospores. 11 individuals actually acquired pulmonary anthrax, and of the 11, 5 people did die from the disease. So there is a risk that this form of bioterrorism could be utilized again, and that has everything to do with why the military is vaccinated towards this disease. But Bacillus anthracis is just an ideal bacteria to use in this situation because of its ability to survive in harsh conditions. It can be easily packaged and administered. So the next disease is hepatitis. So with hepatitis, it is known as a condition in which the liver undergoes inflammation. So we'll be talking about the form of hepatitis that is transmitted by viral pathogens. So there are various causative agents of viral hepatitis which can cause inflammation of the liver. 5 altogether. So there's hepatitis A, B, C, and then D and E. So A, B, and C you likely have heard of. They are quite common here in the United States. Hepatitis D is technically a defective virus, meaning that it cannot cause illness on its own. Hepatitis D can only cause an infection if someone is already infected with hepatitis B, and it can essentially make the hepatitis B infection worse. Hepatitis E is very similar to hepatitis A. It's just only found in developing parts of the world, like South America, Africa, Asia. It is not something that we have here in the United States, although we definitely do have to deal with hepatitis A. So while the signs and symptoms can vary amongst the different forms, what they all have in common is something called jaundice. So regardless of what type of hepatitis, viral hepatitis a patient gets, in most forms they will experience jaundice, which is a yellowing of the skin and eyes. And this is due to a rise in the bilirubin, which is a chemical in the blood that can cause the skin to turn yellow when the liver's not functioning properly in processing the bilirubin into bile. So typically this jaundicing or this yellowing of the skin and the eyes is an indication that there's something wrong with the liver. So we would have to do further diagnostic tests to figure out what's wrong with the liver, but in this course we're going to be referring specifically to viral hepatitis. So I did mention that there are 5 different viruses that can cause hepatitis: A, B, C, D, and E. So A and E are very similar, so we'll talk about those 2 first. So A and E are going to have the same types of signs and symptoms, gastrointestinal signs and symptoms. So vomiting, diarrhea, cramping, and because the liver is being affected, we would also see the The yellowing of the skin, as we know, is jaundice. This form of the virus is transmitted through fecal-oral route, so individuals that have the infection would be shedding the virus in their feces. So if those fecal particles would get on objects or in food or water, and other individuals came in contact with that and got it into their gastrointestinal system, that's how they would become infected. Fortunately, it does not have any long-term effects, so it typically is self-limiting, and most patients will make a full recovery on their own. It is something that can be prevented, most often through good hygiene. So A and E, if you just use proper hygiene and disinfect surfaces and wash your hands after using the bathroom, that's essential to prevention. But fortunately, in the United States, with hepatitis A, we do have a vaccine. So there is a preventative that can be used for hepatitis A. Now, hepatitis E, which is seen in other more developing countries, there's not a vaccine for that one, so that one is just going to be good hygiene.